Robert F. Kennedy Jr. to lead Health and Human Services, a massive role overseeing 13 major health agencies such as the CDC, NIH, and FDA by someone who has publicized disproven conspiracy theories about vaccines and COVID-19 treatments. That pick drew rebukes from top health officials, including former Biden White House COVID-19 response coordinator, Dr. Ashish Jha, who said, "I worry a lot about going backwards just at a time when we have made so much progress in American medicine." Dr. Paul Offit, a vaccine specialist at Children's Hospital of Philadelphia, responding that the notion that a science denialist would head an agency that is built on science is a frightening prospect. And former acting CDC director, Dr. Richard Besser, saying point blank that I think it would be extremely dangerous to have RFK Jr. as the Secretary of Health and Human Services. And Dr. Besser joins me now. It's good to see you, Dr. Besser, this morning. You have spent your career in medicine, in science, 30 years as a pediatrician, 13 years with the CDC. I have to say I've never seen you so outraged. So tell us what kind of power and influence you think RFK Jr. would have.
You know, Martha, I am outraged because lives are at stake here. The head of Health and Human Services touches programs that affect every single life in our country. I've been focusing mainly on the public health impacts. You know, as you know, I'm a pediatrician. I practiced pediatrics for more than 30 years, and there's nothing that I've done for my patients that I know has more positive impact than getting them vaccinated fully and on time. And to have someone leading HHS, who is one of the biggest deniers of vaccines in our country, would undermine the confidence in that program and likely would cost lives.
You know, he said he does not intend to get rid of all vaccines, said he and his children had been vaccinated before the COVID vaccine, which they did not take. So would he get rid of them? Do you think he's lying about that?
Well, it's not a matter of getting rid of them. No vaccine is 100% protective. When you send your kid to school fully vaccinated, you don't want to have to worry that the child sitting next to them, that their parents chose not to vaccinate their child. Because once the level of vaccination in a classroom drops below something like 95%, it's a setup for diseases like measles or whooping cough to spread. If there's a child in the classroom who has an immune problem, that child is at risk. So it's not a matter of saying, oh, yes, you have access to your vaccines. It's pushing the idea that vaccines should be something that is totally up to the individual. We have a social contract in our country. There are things we do for our own health, but there are things we do that are good for ourselves, our families, and our communities. And vaccination falls into that category. And having someone who denies that in that role is extremely dangerous.
He has not only denied some things in that role, or potentially in that role, but he has said there is some sort of autism that is a result of these vaccines, totally not proven.
Yeah, you know, this was a question that was asked and addressed decades ago, and to continue to lift that up is a cruel thing to do. We need to, as a nation, address chronic diseases in children. And one of the dangerous things about RFK Jr. is that there are bits of things he says that are true, and they're mixed in. And it makes it really hard to sort out what things you should follow because they're based on fact and which things are not. We should address chronic diseases. Autism is one of those. And spend money trying to understand what are the causes of autism and how can you address that. But keep lifting up the idea that it has something to do with vaccination is really a cruel thing to do.
And he does push back on pharmaceuticals, and he's gotten praise for that. He does have interest in battling chronic childhood diseases, improving childhood nutrition. So do you believe something good could come out of it?
Well, you know, this is my point. There's some things here that are worth working on. You know, if we're looking at the school lunch program in America, 30 million children get more than half of their calories from that program. It would be a wonderful thing to make that the best school lunch program possible. Give money to schools so that they have kitchens and can make fresh food. get the corporations out of the discussion so they're not pushing processed food. That would be a terrific thing. Getting big business out of the decisions of government health making, that would be a great thing. But when you mix it in with solutions that are based on falsehoods, or some are and some aren't, it's very confusing and could have dire consequences.
Okay, thanks for joining us this morning, Dr. Besser.